Hi, this video is on Morton's Neuroma. Morton's Neuroma is a condition in our feet that happens oftentimes in runners and hikers when they start to put on more miles. We see it in Western Colorado quite a bit because our weather goes from being cold to warm, and we have an active population that goes out there and starts to put miles on in the early spring. And the neuroma is a little inflammation around a nerve between the long bones in your feet. I'm going to use my hand to demonstrate. Now we have these long bones in our feet that have a little nerve that runs through them. And oftentimes, if there is more strain to the tissue in the foot, what'll happen is you'll develop a little swelling on the nerve, and it's more or less like a little cyst on the nerve, and that's what a Morton's neuroma is. And they can be excruciatingly painful. Most of the time people will characterize them as sharp, usually with motion, but a dull or achy pain at rest. And they can be a huge burden on people's lives because we need our feet to move and walk around. And in the active population that we treat, obviously they want to be out there using their feet, running and hiking and playing sports, and it can be a huge burden. So there are natural things that you can do at home to help yourself, and that's what this video is going to tell you how to do it. Now, one of our favorite tools for a Morton's neuroma is an ice cup. Now, there's a lot of people that have different views on ice and if they help or they hinder healing. I'm not here to debate that. I just know that ice, specifically direct ice, usually helps our patients with Morton's neuroma, and oftentimes it's all they need. So we don't sell a whole lot of products, but there is one product we really like. It's called a cryo cup. And what it is, it's more or less like a Jello mold, but you use water and you fill it up with water and stick it in the freezer, and you have this nice cube of ice with a plastic handle so you don't freeze your hand. And what you're going to do with the ice cup is ice between the long bones, right where that nerve is inflamed, and you only need to ice for a couple minutes. You're going to tap it every so often, usually 30 to 60 seconds. And if it feels pretty darn numb, you don't have to do it any longer. The old 15 to 20 minute rule goes out the window. So go ahead, put the ice back in the freezer, cap it, go about your day, come back in an hour or two, and then re-ice it. And if you do that frequently throughout the day, you only spend a couple minutes in total, but it does a really good job of getting the inflammation to go down and decreasing the pain, while still allowing you to use the foot because your pain threshold has gone down, or has gone up because you are decreasing the inflammation. So that's one thing that you can do. The other thing that you can do is massage above the neuroma. So you can take your nail, and oftentimes if you take a nail on a finger and go between the two long bones in the foot, you can actually feel a little bump where the neuroma is. Now, you don't want to agitate it, so you're not going to massage the neuroma itself. But what we say in healthcare, proximal to that, or towards the body above that, what you're going to want to do is massage above that. If you want to get really fancy, extend the toes, take a little bit of tension with your contact point, and then if you bend the toes, oftentimes this type of movement-based massage will help the muscle and soft tissues between the bones create a better environment for that nerve to be, so that the neuroma starts to improve. The other thing that you want to do is check the joint between the toe and your foot. So this is kind of goofy, but if you can wiggle with your hand and see if you can sense any stiffness in the joint between the toe and the foot. And what you're going to do is just kind of move it a little bit more forcefully and trying to get additional movement in that joint. Oftentimes that will help create a better environment for that nerve, and freedom of movement in the foot, which may be part of the cause of the neuroma. A couple other things of advice. We don't endorse any specific brand of shoe or any certain shoe out there for a neuroma. I would be very leery if anyone says that this shoe or this shoe type or this orthotic can solve a neuroma. Now, there are some really good orthotists who may be able to custom create something for you. In a general sense, if you can find a running shoe or hiking boot with a somewhat wider toe box, that will oftentimes prevent a neuroma from developing in the first place. And if you are excessively tightening your laces, oftentimes that'll constrict the foot and not allow for enough motion in the foot. And those are some contributing factors to neuromas. Toe separators. So if you're resting, taking it easy, reading a book, watching TV or whatever, toe separators oftentimes will help kind of just relieve the pressure. And so that's one thing that you can do passively during your downtime, is use those toe separators. Oftentimes that'll help. And once it's getting better, you don't want to go out and expect to do the same amount of activity. One thing that is really helpful with a neuroma after the pain is gone is making sure you're controlling the amount of activity you have in the foot. So you don't want to go back and do what you do at your best. You want to gradually increase the strength of the soft tissues in your foot through a really conservative approach, only upping the amount of activity you do ever so slightly, so that you don't have the neuroma coming back. Oftentimes what we recommend is upping whatever the activity is, about 10% every week or so. And then the other concepts on this will be in additional videos in our running class, and some of the concepts will be in our plantar fasciitis class as well. So stay tuned for those, and if you have any questions, comment or reach out, and we will try to send links or include links to products like this in the bottom. The other thing is, what you can do is you can buy these stainless steel instruments that are really helpful for massaging above the site of the neuroma. So you can find these online and purchase them. You can buy a professional grade lubricant for the skin, or you could just use coconut oil at home. So those are some home-based strategies that we give for a Morton's neuroma. And if you have any questions, let us know. Subscribe to our channel and our social media, and reach out to us, and we're happy to answer your questions.